Hello students, welcome to my YouTube channel MedicoEducation. Today we are going to study about asthma. Asthma is a respiratory disorder and we are going to learn the following objectives. Definition, causes, etiology, risk factors, types of asthma, clinical manifestations, pathophysiology, diagnostic evaluation, complications, medical management, nursing management, and health education. If we look into the definition, asthma is a chronic inflammatory disease of airway. In the given picture on your screen, you can see there is a difference between the normal airway and the asthmatic airway. The asthmatic airway is congested, full of mucus, and the airway is narrowed, while the normal airway is a healthy airway. So it is the disease of the airway that is caused by the allergic response of bronchi, resulting in reversible narrowing of the airway, bronchoconstriction, spasm, congestion and thickening of the walls of bronchi, and accumulation of mucus, recurrent attacks of dyspnea and wheezing. Here you can see a normal airway. When this airway gets inflamed, and when you have an asthmatic attack, alveoli are trapped with the air. Now let's see what are the causes of asthma. There can be environmental factors, which include change in temperature, mostly cold air, and change in humidity, that is dry air. Atmospheric pollutants can be a cause, such as cigarettes, industrial smoke, ozone, sulfur dioxide, and formaldehydes. Allergen inhalation can be a cause too. Foods treated with sulfate, beer, wine, etc. Medications, NSAIDs, beta blockers. There can be other reasons as well, such as emotional upset, strong odors, and perfumes. What are the risk factors? Family history, passive smoking, obesity, urban living, low birth weight, and regular use of NSAIDs. All of these can be a risk factor for asthma. Types of asthma. There are basically two types of asthma, that is allergic and non-allergic. Allergic can also be called extrinsic and non-allergic can be called intrinsic. Allergic asthma commonly occurs in childhood, while non-allergic occurs after 35 years of age. So let's see what is the difference between extrinsic asthma and intrinsic asthma. The ratio between extrinsic and intrinsic asthma is 70 and 30. Extrinsic asthma is initiated by type 1 hypersensitivity reaction induced by exposure to extrinsic antigen. Subtypes include atopic allergic asthma, occupational asthma, allergic bronchopulmonary aspergillosis, personal or family history of allergic reaction, develop early in life. What is intrinsic asthma? It is initiated by diverse non-immune mechanisms including ingestion of aspirin, pulmonary infections, cold, inhaled irritant, stress, and exercise. No personal or family history of allergic reaction, and develop later in life. What are the clinical manifestations? Wheezing, cough at night and in early morning, chest tightness. You can see the SpongeBob is having dyspnea here. So dyspnea, breathlessness, prolonged expiration, hypoxemia, bronchi, that is a sound during inspiration. Attack of asthma may be for few minutes or hours. What is the pathophysiology? Whenever there is a triggering factor that enters the airway gets inflamed. After the airway gets inflamed, there is hypersecretion of mucus, there is airway muscle constriction, breathing passages become narrow, and there is wheezing, cough, shortness of breath, tightness in the chest. Diagnostic evaluation. How are we going to diagnose asthma? Is we are going to do physical examination, history collection, spirometry, ABG, that is arterial blood gas analysis, chest x-ray, auscultation of breath sounds. Then let's see what are the complications of asthma. Respiratory failure, pneumonia, cardiac arrest, status asthmaticus, and atelectasis. Up till now, we have discussed the definition, the causes, clinical manifestations, complications of asthma. Now we are going to discuss what is the medical management of asthma. So what medicines we are going to give are bronchodilators. We also call them beta agonists. They widen the airways, relaxing bronchial smooth muscles by stimulating beta receptors. Salbutamol, formoterol, albuterol, these are the bronchodilators we commonly use. The second medication we use are xanthine derivatives. They have a diuretic effect and relaxes bronchial smooth muscles. Theophylline, aminophylline are the common xanthine derivatives used. Anticholinergic drugs. The action of these drugs include relaxation of the smooth muscle and decrease the secretion of mucus. That is, they have antispasmodic action. Ipratropium is the commonly used anticholinergic. Corticosteroids, anti-inflammatory and anti-allergic action. Methylprednisolone, prednisolone, betamethasone are the commonly used corticosteroids. Leukotriene receptor antagonists, they prevent the action of leukotriene by blocking their receptors on cell membranes. Leukotrienes have a key role in inflammation. Montelukast and zafirlukast are the commonly used leukotriene modifiers. Mast cell stabilizers. They stop the activities of the mast cells. Promolen sodium is the commonly used mast cell stabilizer. Let's move toward the nursing management of asthma. So first of all, you are going to do the assessment of the patient. That is the first step in nursing management. You are going to assess clinical signs of airway distress of the patient. If it is acute airway distress, start emergency management. Then you are going to collect the history, collect knowledge about allergic conditions in different environments, ask about the working place, allergic modifications, and lifestyle. Now let's discuss what will be the nursing diagnosis and implementations. Nursing diagnosis: ineffective breathing pattern related to anxiety or due to airway spasm or edema. Nursing intervention: assess respiratory rate and breathing pattern and depth. Monitor ABGs. Keep patient in Fowler position. Administer oxygen as prescribed. Provide bronchodilators and steroids as prescribed. The next nursing diagnosis is defective airway clearance related to increased secretion, production and bronchospasm. Nursing interventions you are going to do are: suctioning is required in airway obstruction. Monitor sputum for color and consistency. Encourage liquid intake for thin secretion sputum. Increase humidity of room slowly to give oral hygiene in every 2 to 4 hours. Impaired gas exchange due to air trapping. So what are you going to do as nursing intervention are: assess lung sounds in every hour to determine gas exchange. Assess color of mucous membrane or skin for detection of cyanosis. Administration of oxygen. Nursing diagnosis: knowledge deficit due to disease condition. You are going to do the following nursing interventions: provide knowledge about disease, provide psychological support to the patient, advise patient to stay away from allergens, provide comfortable position. What if there is chest pain related to disease condition? You are going to provide analgesics, oxygen inhalation and bronchodilators. Now you are going to educate your patient what to do and what not to do. Avoid allergens, avoid extreme cold weather, avoid mouth breathing, avoid contact with people having viral infections, avoid smoking that may be active or passive. Thank you.